Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. I'm also a non-scientist member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can affect a family. I'm thrilled to be with you today. I see people are continuing to join our webcast, so let's give them just another few seconds, and then we'll get started. Thank you to all of you who are joining us on GoToWebinar, Facebook Live, and YouTube Live. The MS Society's Ask an MS Expert webcast is designed to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. So as I chat with our expert today, please feel free to post your questions on Facebook and YouTube, or type them into the question box if you're joining us on GoToWebinar. We'll try to answer as many of your questions as we can during the Q&A portion of today's program. More than half of all the people living with MS experience some degree of change in cognition. The first thing that everyone should know is they're not alone in experiencing these common symptoms, and there are specific strategies you can use to effectively manage them. Today, we're talking with Dr. Meghan Beier. Dr. Byer is an assistant professor of physical medicine and rehabilitation at Johns Hopkins University School of Medicine. And as a rehabilitation psychologist, she specializes in cognitive rehabilitation and neuropsychological assessment and intervention. Dr. Byer works with patients with a variety of neurological and psychological conditions, including multiple sclerosis and traumatic brain injury. Dr. Byer is also an active researcher interested in cognitive rehabilitation, mental health, and the healthy aging of individuals with MS. And if you're experiencing a sense of deja vu, well, your sense is correct. Dr. Byer joined us just a few weeks ago to talk about cognitive changes in MS, and in the days following that webcast, you sent us so many questions that we've invited her back to answer more of your questions. So welcome back by popular demand, Dr. Byer.
Sure.
You know, cognitive changes in MS is such an important conversation. I want to get right into the questions we've been receiving. Jamie reached out to us on Facebook, and she wants to know, what are the ways that MS affects cognition? So I think that's a great place to start.
Absolutely. So the most common issues that people living with MS experience are things like slowed brain speed, getting easily distracted, having difficulty finding words in conversations or words coming a little bit more slowly, and having difficulty learning new information. There's also sometimes difficulties with things like planning and organizing information, and what we call visual spatial difficulties, which might be something like trying to pack the trunk of a car with a lot of different luggage, or having to put something together from IKEA, or even reaching for a cup and missing the cup in space. So those are some of the difficulties that are most common for people with MS.
And these sound like difficulties that are they impact everyday life, don't they?
Absolutely. They have a huge impact on everyday life, and which is one reason why we think it's really important that they get assessed and that they are addressed as early and as quickly as possible.
Well, we got a question from Karen, I guess a concern. She wrote in and said her partner has MS, and she's noticed her forgetting appointments and having trouble following recipes that she's already very familiar with. Is this what cognitive issues related to MS might look like, or could this be from something else?
Sure, yeah, absolutely. This could be from MS. However, I really advocate for investigating any other potential causes for cognitive difficulties before immediately addressing it to MS. So one of the reasons for this is that cognitive changes don't just come because of MS. So for example, if you've ever grieved the loss of a close loved one, you might have noticed that during that time you were more forgetful or had more difficulty thinking through things that have multiple steps. And so, things like forgetting and executive difficulties, which would be like following a recipe, can also be common for people who are in the midst of grief or depression. And they can also come around for things like sleep difficulties. So we'd really want to investigate any other potential causes that might be leading to those symptoms, and then evaluate those and determine whether they might be also potentially having an impact or if it really is just MS.
Nancy wrote in with an interesting question. She wants to know if cognitive symptoms can affect people with all forms of MS. So are the cognitive symptoms in someone with progressive MS the same as the cognitive symptoms that someone with relapsing remitting MS might experience?
So they typically are similar symptoms, but there is some differences in terms of how common cognitive symptoms are depending on the type of MS. So approximately about a third of people, even before they're diagnosed, so something that we call clinically isolated syndrome or radiologically isolated syndrome, about a third of people who have those types of syndromes and people who are newly diagnosed have cognitive difficulties. There's a similar number of people, about a third of people with relapsing remitting have MS. Secondary progressive MS, the rates are higher, so sometimes between 50 and 80% of people might experience difficulties. But I think it's important to remember that secondary progressive MS is a transition after relapsing remitting MS, so there could also be factors there in terms of aging. So if you've lived with MS for several decades and you're aging, there might also be some contributing factors that are MS, but also things like that come along with aging. In primary progressive MS, it's a little bit more unclear about the prevalence rates because they vary so widely between different studies. Some say that, less than a third of people with primary progressive MS have symptoms. Some studies have shown as high as 90%. And so it's a little bit less clear in terms of how common they are for people with primary progressive MS.
Jonathan wants to know if experiencing cognitive difficulties means physical disability is also likely. Do these two things go hand in hand?
It's a good question, and it's a little bit complex. So there is an association between cognitive difficulties and physical disability. So for example, there have been a few studies that looked at people who have cognitive difficulties at the time of their diagnosis. And for those individuals, there is a higher likelihood of physical disability, 5-10 years down the line. However, it's not a one-to-one relationship. So for example, if most of your physical disabilities are associated with lesions in the spinal cord, that may not necessarily mean that you have cognitive difficulties. You may have little cognitive difficulties or none at all. So there is an association, but it's not one-to-one.
After our first conversation just a few weeks ago, we heard from Shirley, who shared that Alzheimer's runs in her family. So she initially thought her cognitive issues were due to early onset Alzheimer's. And Shirley asked how she could know if her cognitive issues are due to MS or Alzheimer's. So how do you differentiate MS cognitive symptoms from cognitive symptoms that come from other medical conditions like Alzheimer's or dementia?
Yeah, absolutely. So for each medical condition, there are different types of cognitive profiles. So what a person with MS would look like on cognitive testing would be different than a person with Alzheimer's disease, and similarly different than another medical condition that somebody might have. So, for example, the most cognitive symptoms in MS are things that I said already, like slowed processing speed, meaning the brain is slower or processing information a little bit slower than it used to, difficulties with multitasking, difficulty learning new information, not retaining, that's actually okay for most people with MS, but learning new information, and word finding difficulties. However, most people with MS are really able to recall memories from their childhood. They're largely able to remember the things that they do actually learn and get encoded. They know who they are, they know where they are, they know what they're doing. So I think it sometimes takes people with MS a little bit longer to access their lifetime of knowledge, but that knowledge is usually still there. For Alzheimer's disease, the picture is pretty different. So people with Alzheimer's tend to have a flat learning curve, meaning they don't learn more information no matter how much they're exposed to it. And then after a delay, they often aren't able to remember anything that was previously exposed to them, or very, very little in the early stages of Alzheimer's. People with Alzheimer's have much more pronounced language difficulties, and they often, as the disease progresses, have more and more difficulty with knowing where they are, what the date is, and kind of information around them. They also tend to start losing information from the past. So we can kind of look at the cognitive profile when we do testing, and we can have a good idea of whether or not something is MS versus something like Alzheimer's.
As you just mentioned, in Alzheimer's disease, cognitive issues get progressively worse over time. Do MS cognitive issues also get worse?
Sorry, can you repeat that question?
Well, there you are. We can't hear you, but it is nice to see you. Hopefully we'll get some audio. I don't know that we're hearing you at the moment. Oh, wait.
Okay, I can hear you.
There we are.
Technical issues this time around. Sorry, can you repeat the question?
Yeah, not a problem at all. I was just saying something you pointed out. In Alzheimer's disease, cognitive issues get progressively worse. Do MS cognitive issues get worse over time?
Yes, well, in some cases. So there's been a few different studies that look at trajectories of cognitive difficulties over time. And so it kind of depends on where you start off. And with Alzheimer's disease, the disease tends to progress very rapidly, and within a few years, somebody could be quite impaired cognitively. With MS, if there is progression, it tends to be much more slow and much more subtle. That's not to say that it doesn't progress. So in at least one study, they looked at people over the course of 6 years, and they found that if you had no symptoms at baseline, then there was about a 60% chance that you might have one cognitive area that was impacted over the course of 6 years. If you had a lot of cognitive symptoms at baseline, then you might continue to have those difficulties, and potentially one or two more, or those domains would be a little bit more impacted over time. So it is possible to progress, but it's certainly not as fast and not as severe as something like Alzheimer's.
There are other symptoms of MS like fatigue, depression, and sleep problems, to name a few. And these symptoms can also affect cognition. How do you know what's causing the changes in cognition?
Yeah, absolutely. I mean, there's a number of different things, like you said, that can cause cognitive symptoms. So first, again, we look at that profile on cognitive testing, because For example, something like depression, we might see more memory difficulties and planning and organization, but other things might be okay. Things like sleep apnea, we might really just see difficulties with executive functioning or planning and organizing. So we really are looking at the profile and kind of seeing what's going on. For fatigue, which is so common in MS, a lot of times there's this ebb and flow of cognitive difficulties. So you might feel a little bit more sharp in the morning, and then you're less sharp as the day goes on. Or if you've overdone it the day before, you feel less sharp for a day. And so a lot of times when fatigue is the culprit, it's not a steady cognitive difficulty. It kind of comes and goes. So really, if somebody is experiencing mood difficulties or fatigue, or even like severe sleep problems, I usually sort of assume that those are having some impact, try to address those symptoms, try to get them a little bit better, and then see once they've improved, what symptoms are still sticking around.
Well, speaking of addressing symptoms, getting a handle on managing cognitive symptoms begins with getting an assessment of cognitive function. Does an assessment of cognitive function early in the disease course make a difference?
Yeah, absolutely. I mean, I think it's really important to get a baseline cognitive assessment. That's not always possible because of insurance purposes or access to people who do cognitive testing, like a neuropsychologist. But when we do neuropsychological testing, what we're looking at the scores and we're comparing them to your age and education matched peers. And so that gives us good information, but it doesn't necessarily tell us how you specifically have changed. It gives us a good hypothesis of whether or not you've changed, but it's not a one-to-one. So if we have testing from baseline or from early on that we can compare to as time goes on, now we're comparing you against yourself. And so we really have a good idea of whether you have changed over time, not just if you're similar to your peers. You know, for example, if you're highly intelligent and most of your peers are sort of in the average range in terms of age and education, it might not look like you're having impairment, but you notice that you're having impairment. And so that's why it's so important for us to know how you've done in the past so that we can compare you to yourself.
So how does someone know when it's time to discuss their cognitive symptoms with their healthcare provider?
I think that it's never too early to talk about it. Even if you're not really noticing symptoms right now, I think that when you work with your healthcare provider and you say, what can I do to prevent this, or this is something that I'm concerned about, many times they can give you some ideas for how to maintain your cognitive functioning or keep it as strong as possible. So it's never too early. And just like every other symptom of MS, I think it's really important for you to keep an eye out on it.
I've actually heard the terms cognitive screening and evaluation used when it comes to cognitive assessment. Do these mean the same thing, or is there a difference?
There is a difference. So screening really gives us, it's usually very short and it casts the net wide. So it's really looking at picking up as many people as possible that might be having difficulties. So that might be something in your neurologist office that might look like a 90-second speed test that's matching shapes with numbers. Or that might look like a brief cognitive test that you're doing on the computer in the waiting room or on an iPad that can take anywhere from 5 to 10 minutes. Or it might look like them asking you 3 words and having you repeat them back later, along with some other tasks in between. So those are screening instruments. An assessment usually takes anywhere from, on average, it varies by provider, 2 to 6 hours, and it's very in-depth. So there's usually a long interview where we're asking lots of questions about your background history, your comorbid medical conditions, your medications, all of those kinds of things. It might involve cognitive testing, so testing all these different domains that I mentioned earlier, like memory, attention, processing speed. And then it might also even dive into doing more standardized tests of sleep, mood, fatigue, those kinds of things as well, because we really want a full picture of what's going on and what are all the potential causes and also avenues of treatment that could be impacting your cognition.
We heard from Veronica, who's considering having a cognitive assessment done, and she's wondering how often her cognition should be monitored following the assessment.
Sure. Yeah. So the current guidelines, the national guidelines, are that you should have screening at least once per year, and that you should have screening more often if you are having changes at work or at home, so your functioning has changed, or if you're having difficulties at school for those who are in school. If you're not, and then if you screen positive, then the guideline is for a full one of those more in-depth assessments, the kind of 2 to 6 hour range ones. If you've had a full assessment and you're not noticing any significant changes, you haven't had an exacerbation, no changes in your functioning, I typically recommend people have those full assessments about once every 3 to 5 years, because it doesn't change so quickly. We kind of have to balance. If you're exposed to the tests very frequently, you get better at them. We call that the learning effect, with catching symptoms as they progress. But if you're getting that yearly screening, then that should pick up on any changes that might be happening, and then you can get that full in-depth testing more frequently or sooner if than the 3 to 5 years that I'm talking about.
Veronica is also wondering if a cognitive assessment is typically covered by health insurance. So what should she be prepared for here?
That's a really good question. It's very variable depending on the insurance. So most insurances will cover neuropsychological testing. They usually only cover it, well, most will only cover it once per year. Some will cover it if there's, for example, I said everyone should have a baseline. Some insurance will not cover a neuropsych assessment if there aren't active symptoms or there aren't documented symptoms, but it's just dependent on the insurance. Some will, and some will cover it if you have a neurologic condition that could impact your cognition. So it's really best to contact your insurance provider and find out the answers to those kinds of questions.
Well, thank you for sharing these very helpful insights into common MS cognitive symptoms and how to test for them. Before we get into discussing how to best assess and treat MS cognitive changes, I want to take a quick moment to welcome those of you who have continued to join us on GoToWebinar, Facebook Live, and YouTube Live. Please let us know what's on your mind. Post your comments and questions on Facebook and YouTube, or type them into the questions box if you joined us on GoToWebinar. Our Ask an MS Expert live event takes place at the same time every Friday, so please help us make sure that everyone knows about it by sharing news about the webcast with your family and your friends. We're talking with Dr. Meghan Beier about cognitive changes in MS, and we're going to get into how to assess someone's cognition and how to manage that situation once you do. So Dr. Beier, are there ways to assess someone's cognition other than the old-fashioned pen and paper methods?
Yeah, absolutely. And there's more and more of these avenues coming out. So there are some computer programs and iPad apps that are already being used in many neurology offices. So some of those include things like NeuroTrax, CogState, a Cog Eval, or the MS Performance Test. And this is an area of interest of mine as well. And in my own research, we've been examining ways to take those paper and pencil tests and try and transition them to technology-based things like applications. And we've also been working with a group out of Harvard that has an online platform that's free and open access called Test My Brain, just to see if those kinds of, so if you have a free and open access way to assess cognition, this would impact things in a positive way in terms of financial concerns that come out, or those people that their insurance doesn't cover cognitive problems. So there's more and more ways that we're figuring out to test cognition outside of that traditional paper and pencil.
What have you seen as the pros and cons of these technology-driven methods?
Yeah, so some of the pros are things that I've already mentioned, which is that, we could potentially overcome some financial barriers with things like this. And many times these things are self-administered, which takes some of the burden off of clinic staff, or if you only have limited time in a clinic appointment, it gives you the ability to assess cognition without taking away from other things that are really important to discuss. However, if you're taking these kinds of tests in a waiting room or at home where there's distractions, then the test results could be inaccurate. And these cognitive tests that are done by computer are really good at picking up processing speed, which is important because that's one of the #1 areas that's impacted by MS, but they don't pick up some things very well, like learning. So if we're looking at learning curves, which is one of the main problems with memory in people with MS, the computerized tests don't do that as well. They really just look at recall and recognition. So there are some pros and cons.
Well, beyond just using technology to assess cognitive symptoms, are there ways to use technology to treat cognitive issues?
Yeah, absolutely. So there's some game-like apps that have been studied in MS. So those are things like there's a program called Cognitrack, and there's also something called Brain HQ, which has been studied at places like Kessler and NYU, and they have shown improvements in cognition by using these apps. And there are also some programs, some computer programs and things that are used by, that have to be used with a licensed professional like a speech pathologist or cognitive rehabilitation specialist. And those are things like attention processing training, which is a computerized program that helps people improve their attention skills. But outside of those kinds of apps that you can do, apps and computer programs that you could do from home, because of COVID, there are a lot of providers who are now doing this sort of thing, working one-on-one with people using webinar technology or connecting into people's homes so that you're able to connect with a therapist who has access to these kinds of programs, but from your own space and from home. So I would encourage people to really look into working with a speech therapist or an occupational therapist or a neuropsychologist who does interventions, because now a lot of times we can do it from home.
A lot of people have asked about cognitive reserve. Can you explain the concept of cognitive reserve and tell us what the research shows?
Yeah, absolutely. So I'm going to start off with kind of a little bit of an example, and then I'll go into what cognitive reserve is. So if we look at an MRI for a person with multiple sclerosis, the lesions that are seen on MRI really only tell about 1/3 of the story. So why is it that some people can have a ton of lesions but seem to have very little cognitive change or even very little physical change? And some people may only have 1 or 2 lesions but seem to have a huge impact. Some of that might be location and some other factors, but one piece of it is this idea of reserve. So it's a person's ability, it's our brain's ability to tolerate pathological change and still maintain their functioning. So if we think about it, there's kind of 2 different forms of cognitive reserve. Now there is some overlap and interaction, but if we kind of want to divide it, there's 2 different types of reserve. One is called cognitive reserve, and the other is brain or passive reserve. So brain or passive reserve are things like the number of neurons that you have, the number of synapses or connections that you have in the brain, or even just the general size of your brain, and some things that may be outside of your control now. So how far you got in school, or what kind of career you went into. Now, obviously, some of those things can be modified as time goes on, but if we're looking backwards, we're looking at, what kind of education did you get growing up? Cognitive reserve are things like, is your brain actively trying to cope with damage by using either pre-existing processes or compensation techniques, or maybe even improving your reserve by engaging in things like hobbies, social interactions, exercise, going to classes, playing cards or games, learning a musical instrument, really things that keep your mind active and engaged.
So maybe you can sum up a bit about how exactly cognitive reserve helps someone with MS.
Mhm. Yeah, so I mean, I think if we know that some people have some baseline reserve because of that brain or passive reserve. So if you were born with a larger brain or more connections, or you had more connections that were formed because of the type of education you had growing up, you are more likely to be able to have an impact or a lesion or an exacerbation and not have it impact your functioning or not impact your functioning as much. If you have less brain or passive reserve, then you might be more likely to be impacted by an exacerbation or impacted faster. In terms of the other type of reserve, what we're looking at is that you can build up your reserve. So if you are engaging in activities that we consider cognitive reserve, like those that I listed earlier, then you can build up your reserve, meaning that you can build up the ability to sort of roll with the punches, or maybe even build up some cushion if you were to have an exacerbation in the future.
Well, speaking of rolling with the punches, Jillian wants to learn how she can better accept the cognitive challenges that she's experiencing. She's worried that MS is ruining her career. What advice would you give Jillian and others who are struggling with accepting their cognitive challenges?
Sure. So I think first the thing that I do with my patients is really understand what they mean by accept, because accept is a really loaded word. To me, it sort of implies that you no longer are frustrated with these things, or that they no longer impact you. And I think that that's pretty unrealistic for most people. I think it is very normal to feel frustrated and upset by changes that have occurred. So one thing is to think about how you are already coping. You're living with this already. And so giving yourself credit for the things that you're already doing to cope with a really difficult condition that has a big impact on your life and your vocation. Give yourself time to grieve, but don't live in that grief. So when I talk to people about that, I say, sort of give yourself, if those thoughts and those feelings arise, give yourself 5 to 10 minutes to be frustrated, to be upset, to kind of, express that for yourself, but then have a plan for distracting yourself and a way to talk to yourself that brings you out of that. In terms of kind of how that's impacting career, I mean, there's lots of things that can be done, but it may also be sort of thinking about how cognition is impacting your career, and maybe other things that are impacting career, other ways that you can preserve your vocation outside of things like accommodations or working with a vocational therapist.
What advice do you have for how to best talk with your family, friends, and even colleagues at work about cognitive challenges?
So I think it just depends on your family or your friend or your colleague. So some family and friends are really open and want to learn more. Some are more closed off, or they don't really understand it. So I think first is kind of understanding their perspective and understanding what they want to know about it. But you might, if they want to know more, you might bring them to a webinar like this, or there are lots of webinars that Can Do MS puts on, or the National MS Society puts on. You might bring them to a medical appointment with you, just so that they can have their questions answered and kind of understand a little bit, learn as you learn. In terms of colleagues, I think that can be a little more tricky. So I think you should think carefully about your work environment and the type of relationship that you have with your employer or your colleagues. I've certainly seen people who have really great relationships with colleagues after they share their challenges with them. I've also seen the opposite, where people have a huge impact on their vocation when that information is shared. And so often, if you have any concerns or worries, or even a niggle in the back of your head that maybe there might be an impact with sharing this with your work, I might talk to a vocational counselor or work or call someplace like the Job Accommodation Network to talk it through with them. Because certainly unfortunately, there still are sometimes people who don't fully understand MS, and so it can have a negative impact.
Well, we've already covered a lot of ground today. Dr. Byer, what would you say are the top 3 takeaways that our audience should keep in mind?
Sure. So number 1, you should get cognitive screening every year. So if you're not getting that, ask for it. There was a study that came out that showed that many people with MS, at least a few years ago, were not getting regular cognitive screening. And this symptom is just as important as every other MS symptom. So if you're not getting the screening every year, ask for it. Number 2, I would say, is from a cognitive perspective, keeping your mind active and engaged is really important. And so that can look very different for lots of people. But I think this is especially important for people who are either choosing to leave work or choosing to reduce our work hours, or maybe even have to leave their workplace, kind of coming up with a plan. A lot of times as I'm working with people as they transition out of work, coming up with a plan to keep your mind active and engaged so that you don't lose that active reserve. And then knowing that there are interventions that can be helpful for improving and maintaining your cognition. And that can look like doing those computerized programs from home, or that can be working with a therapist, or also addressing the many other factors that might be contributing to your cognition. So know that there is something that can be done for your cognition, and it's perfectly within your rights to ask about it.
Well, thank you, Dr. Byer, for sharing your expertise on an important topic that our audience has made clear that they want to learn more about. Now I'd like to focus our time on addressing more of the questions that our viewers have for you. We've heard from Thomas on social media, and Thomas said, "Sometimes when I get cognitive fog, I literally forget where I am and get confused and scared. Is that normal?" Dr. Byer, first, what is cognitive fog, and can it cause this level of forgetfulness and confusion?
Yeah, sure. So cognitive fog, I think it depends on who you ask, because it's not necessarily an academic term or a diagnostic term. So it depends on the person who's using it. I tend to see it from most of the people that I work with as sort of the fatigue or other factors that are impacting cognition over and above MS. So it's kind of a layer on top of your to kind of baseline cognitive difficulties. And so I've certainly heard of people who, when they have cognitive fog, feeling very confused or feeling like their cognition changes rapidly. I think it's something it's worth getting investigated, because certainly there are other things that could be impacting it, like having a urinary tract infection. But things like heat sensitivity and fatigue, and even certain types of medications can all bring on that fogginess. So it's worth understanding where that's coming from.
Well, while you and I have been chatting away, I know Julie has been dutifully fielding questions from our audience in real time. So Julie, I'm hoping you'll pop up and share some of those questions.
I do have lots of questions. Thank you so much. Dr. Byer, we have so many people with some questions for you, so I'm going to try to get through as many of those as we can. First, we've heard from Mindy, and this is something that I know I've heard from a lot of people, and I imagine you have too. I often feel, these are her words, stupid because I can't think of the right words to use. Do I tell those that I'm talking to I have MS and I'm not stupid, or how do I handle that situation?
Yeah, absolutely. I think that well, number one, I want to say you're not stupid. And we know from research, if you want to back it up, that people with MS, their IQ does not change. And so you maintain your intelligence, but it's kind of like your bandwidth maybe is overloaded. And so it takes more time to get to the place you're wanting to go to, but it doesn't mean that you can't get there. So in terms of telling people, I think that's a very individual decision. So some people I work with feel very open with sharing that with people around them, and they feel like that helps them. Other people don't feel like that helps them, or they feel like they are more reserved. So I think it's a very individual choice, and sometimes it might take trying it out with a few close friends or relatives and seeing if that makes you feel better or worse, and then determining whether you want to continue sharing that or approach it in a different way.
Your answer pretty much got at a question I just got from social media from Brandon. He's saying he's a person of high intelligence, and so how does he get his doctor to acknowledge that he could also be having cognitive issues? Do you have any specific advice for Brandon?
Yeah, I mean, maybe get a second opinion or see if they will refer you to a neuropsychologist, because this is one of the things, you know, if we look at cognition on a normal curve, which is how we typically look at it, if you were in the 98th percentile, you could still be in the high average range, but have a significant change in your cognition. And so it's really about the change that you're experiencing and not necessarily where you fall on the normal curve. It still might be very real to Brandon and likely is, but it might not show up on those more general screenings. So having a neuropsychological assessment may be really good because it might be able to get at the nuances that he's experiencing.
Glynis wrote into us with registration to say, when do you know that cognitively it's no longer a good idea to drive?
That's a really good question. So I would say, are you getting into fender benders? I would maybe ask other people if they feel safe driving with you. And if you're still not really sure, there are occupational therapists who specialize in driving, and you could always get, I tell people this is kind of the safe way of getting an evaluation of your driving, because they don't always necessarily, depending on state restrictions, take away your license, and they may actually do the assessment and then help you drive more safely. So working with an occupational therapist who specializes in driving might be a way to keep your license for longer and drive safer.
We've had lots of questions coming from our folks watching on social media. Sonia and Isa are both asking about MRIs, and do cognitive impairments or changes in cognition show up on MRIs?
So it's a loaded question a little bit. It's a little different. Like I said, there are about MRIs and lesions tell about a third of the story in terms of cognition. And there's not always, a lot of times I get asked, like, if the lesion is in this location, will it have X outcome? And it doesn't really work that way for people with MS. A lot of times the lesion could impact a pathway that sends information from point A to point B. So the lesion might look like it's in one place of part of the brain, but impact something different. So certainly there is a correlation between number of lesions or brain atrophy and cognitive outcomes, but it's a little more complex than that.
We heard from Jamie on social media, who has a question about diet and exercise, but we also heard from Charisse, who says she's a vegan and she'd like to know if there are certain foods that can help with cognition. So any recommendations around changes to diet or exercise that could help cognition?
Sure. So I'll start with exercise. We know that exercise helps improve or maintain cognitive functioning. So a secondary analysis that I did back in my postdoc days, we found that people who improved their physical fitness over the course of 12 weeks also had an improvement in their executive functioning or their ability to plan and organize. And that there's a number of other studies that are showing that exercise can help you with cognition. So certainly anything that keeps your body healthy is going to keep your brain healthy. There are other things like plaques that can grow in your blood vessels. Then if that happens in your body, that can also happen in your brain. So this is another thing that's outside of MS, and certainly exercise can help reduce that. In terms of diet, there's no one diet that has been found to impact cognition specifically in MS. It's really kind of understudied at this point. There's a few trials going on looking at this, but the data is still limited. If we look outside of MS, things like the MIND diet, which is a combination of the Mediterranean diet along with the DASH diet, which is kind of reduced salt, as well as some addition of things like berries and things like that, has been shown to reduce risk of transitioning to Alzheimer's disease in people with mild cognitive impairment. So it's possible that certainly eating healthier is more likely to improve your outcomes over time. If you were, eating potato chips and McDonald's every day, more likely to have more cognitive problems. But I think I just more generally would say that if it's keeping your body healthy, it's likely keeping your brain healthy as well.
John, do we have time for one more question for Dr. Byer?
Sure.
I was asking very nicely. So we've heard from a lot of people who are asking, how do you know when your cognitive changes are from aging or from MS? And we also heard from Jennifer that wants to know are her cognitive changes from menopause, which is related to aging. So any specific advice for folks on, it seems like we're getting people that are pointing the fingers. Your MS provider might be saying it's aging. Talking to your primary care provider might be saying, oh, you have MS, your cognitive issues are MS. What's someone to think and do?
So for the aging question, neuropsychological testing for sure is going to get at that answer because, like I said previously, we take your score and we compare it to people who are the same age and have the same amount of education. So we're saying, are you performing similar to other people who are your same age? So if you're not, then it may be that it's likely due to MS or some other cause. If you are performing similar to people your age and you're experiencing these symptoms, then it's likely that those changes are age-related. Starting in our 20s, everyone's processing speed declines, whether you have MS or not. And so we do all have cognitive changes throughout the course of our lifetime. And so neuropsychological testing can help parcel that out. In terms of menopause, so there's lots of things that can impact your cognition from a hormone perspective and things like that. I think, again, some neuropsychological testing would be helpful to kind of pull out the intricacies of that.
Thank you, Dr. Byer. Thank you, John.
Well, thank you, Julie. And thank you, Dr. Byer, as well, for sharing information on such an important topic. I appreciate all of your input. Thank you to all of you who submitted your questions. I have some resources that I'd like to share with you, and you're going to see them on your screen in just a second. I hope you take advantage of them, whether it is checking out Dr. Meghan Beier at hopkinsmedicine.org, whether it is checking out the MS Society MS Navigators, which I'm going to tell you more about in just a minute. And of course, I hope you'll take a moment and check out the Real Talk MS podcast. It's available anywhere you find your favorite podcasts. We're all witnessing that even during a pandemic, MS doesn't stop, and neither does the National MS Society. Well, this webcast is just one example of how the MS Society has created virtual programming on the fly so that no one has to face MS alone. They've also created virtual support groups. They provided great resources and information about COVID-19 so that people affected by MS can get answers to their questions and healthcare providers can deliver the very best care to their patients. The National MS Society COVID-19 Response Fund was established to ensure that the Society can meet the urgent and expanding needs of the MS community during these very difficult and unprecedented times. So I'm asking, as you're able, to support the MS Society's work by making a donation to the COVID-19 Response Fund. To donate, just text the word GIVE to 68686, and you'll get a link to the MS Society's COVID-19 Response Fund webpage. I hope you'll contribute today because, frankly, it's never been more important. I want to remind you that if we're unable to get to your questions today, Please know that the National MS Society's MS Navigator team is available to answer your specific questions and connect you to the very best resources. You can find an MS Navigator at the MS Society's website at nationalmssociety.org. You can contact a navigator by phone at 1-800-344-4867, or you can email an MS Navigator at contactusnmss@nmss.org. And don't forget, you can connect with the MS Society on your favorite social media channels, including Facebook, Instagram, Twitter, YouTube, and LinkedIn. I'd like to thank Dr. Meghan Beier for joining us today, and I'd like to thank everyone who's joined us for your great questions. Please remember that a recording of this webinar is going to be available for your review on the Society's website at nationalmssociety.org/msexpert. Getting your feedback on today's webinar is important, so you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, or you'll see a link to that survey pinned to the comments section, and on YouTube, you'll find that link in the program description. Completing the survey takes just 1 minute and makes a real difference, so I hope you'll take a minute to fill it out. On behalf of Dr. Meghan Beier and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.